She was particularly low, just sat at home watching TV, not leaving her house for days on end. She used to really enjoy gardening. She's really involved in crafts with her friends. She just wasn't doing any of these things because she felt like she couldn't do it. Hello, it's Karina calling from the Wellbeing Service. Hi, how are you today? What I would say is, yes, it is scary, especially if you've never talked to anyone about this before, but we are all here to support people, and we're never going to tell you what to do. It's all about what you want to do to make those really small steps towards your recovery.
My name's Gabby. I'm one of the Psychological Wellbeing Practitioners at the Wellbeing Service. That means that I support with common mental health difficulties like anxiety and depression.
A psychological wellbeing practitioner helps people learn techniques to help their mental health. So telephone PWP support can be beneficial to lots of people really, people having difficulties with a stressful life event or big changes that happen in their lives. One of the clients I worked with was a military veteran. He found it really difficult to come forward for help. He was starting to feel quite down about himself, feeling a bit ashamed about how he felt, really.
I was working with a lady managing worry. That's a technique where we look at worry time for the things that we can't change, things that we have no control over, and problem solving for the worries that we can change.
There was a lady that I supported who it was felt that telephone sessions would be more helpful. We basically looked at what her main problem was, which was depression. We tend to offer about 6 sessions, regularly spaced out. We generally offer fortnightly. They're generally about 30 minutes.
We can work at each individual's pace. We have up to 6 sessions. We can tailor that to your own personal preferences and the things that you would like to work on. We spoke about the idea of having a worry box. That's something that I do in my job as well. So when I'm experiencing a lot of high stress in work or having a lot of anxiety around the things that I'm doing, I use the worry box. I have it on my desk behind my laptop and I will post things in there as and when they come up. It's a way of staying focused on the present moment.
He was very worried about how his partner's family were judging him. So we kind of took some of those thoughts and we asked him to record some of his thoughts in a diary. But once he identified that actually some of what he was thinking wasn't really fair and wasn't really accurate, he started to feel differently and we were able to process some of the thinking that he was having.
When I started talking to her, we came up with the idea that actually a CBT technique called behavioural activation would be really beneficial. And it's all about getting people to start gradually doing a little bit more with their days again. So firstly, it's about getting her to list what are those things that you've stopped doing or you're finding really difficult to do. Okay, out of all those things that you find really hard to do, where could we start? So we gradually started to get her just out of the house. That might sound really small to some people, but that's such a big deal, and it was for her.
It is based quite heavily on what patients do between sessions and the home practice as such, so that when they're discharged from the service, when they're beyond needing that support, they have a toolkit of skills that they can rely on and help.
He started to be able to be a lot more compassionate to himself, much less negative thoughts about himself, and just being a lot more positive about himself, really.
It's really lovely being alongside that person for that journey of treatment and noticing the changes that they've made.
As I started to talk to her, every session she sounded brighter, and that was really lovely. She got to a place where her symptoms had really dropped. She felt that she was back to who she was.
The best thing is seeing people recover and seeing people start doing things again that they've stopped doing, start to feel back to themselves really, and start enjoying their lives again.